Can biomarkers confirm a Parkinson's diagnosis? Imagine trying to solve a complex puzzle where each piece tells part of a story. That's similar to diagnosing Parkinson's disease. Doctors relying on symptoms, medical history, and neurological exams. But now, scientists are exploring biomarkers as additional clues. Biomarkers are measurable signs in the body that can indicate disease presence. They can support diagnosis but are not yet definitive on their own. One of the most promising biomarkers involves a protein called alpha-synuclein. In Parkinson's disease, this protein misfolds and accumulates abnormally in the brain. Researchers have developed tests that detect these abnormal forms of alpha-synuclein in cerebrospinal fluid or skin tissue. These tests have shown high accuracy, around 93%, in identifying Parkinson's. However, they cannot yet reliably distinguish Parkinson's from related disorders like dementia with Lewy bodies or multiple system atrophy. So, the results must be considered alongside clinical symptoms. Neuroimaging is another tool being used to support diagnosis. Techniques like dopamine transporter scans, single photon emission computed tomography, and positron emission tomography look at the health of the brain's dopamine system. These scans can help differentiate Parkinson's from other movement disorders and monitor how the disease progresses. But they are costly and not typically used at the very first diagnosis. Scientists are also studying other potential biomarkers, such as certain proteins involved in brain inflammation or genetic markers. For example, mutations in genes like SNCA and LRRK2 are linked to Parkinson's risk. These markers might someday help predict how severe the disease could become or how quickly it might progress. But right now, they are still in the research phase and not part of routine diagnosis. It's important to understand that no single biomarker can confirm Parkinson's disease with absolute certainty yet. They are best used as part of a comprehensive approach that includes clinical assessment and patient history. Some tests requiring invasive procedures like lumbar punctures to collect cerebrospinal fluid, which can limit their widespread use. In summary, biomarkers are a promising tool that can support and enhance the accuracy of Parkinson's diagnosis. They are especially helpful in early or unclear cases and may someday help track how the disease responds to treatment. But for now, they are adjuncts, not replacements, for careful clinical evaluation by healthcare professionals. If you or someone you know is concerned about Parkinson's, consulting a neurologist remains the best step for an accurate diagnosis and personalized care.